As we age, our bodies begin to break down and become less effective at regulating temperature and fighting infections and other illnesses. Older adults are more susceptible to injury, accidents, and illness than younger people. Specifically, as we age, more and more fatty plaques accumulate in the arteries, increasing the risk of atherosclerosis. Aging causes the bodies of middle-aged and elderly people to lose calcium and other minerals. The rapid decline in bone density due to aging makes bones thinner and weaker. The elderly are also more susceptible to disease because aging makes cells more vulnerable, the recovery process is slower, and resistance is reduced. Common diseases in the elderly are also more likely to develop because the elderly are easily tired, do little exercise, sit or lie down a lot. Common diseases in the elderly. Some common diseases in the elderly include 1. Diabetes. Diabetes is a chronic disease of older adults, affecting about 33% of people aged 65 and older. It occurs when the body does not produce enough insulin or cannot use insulin properly, or a combination of both. When the body has problems with insulin, the body has high blood glucose levels, hyperglycemia, which over time can cause health problems. Symptoms of diabetes in older adults can range from mild to severe, including increased thirst and urination, blurred vision, fatigue, dizziness, and fainting. Not all older adults with diabetes have all of these symptoms. Depending on the severity of the disease, the patient may experience one or more symptoms at the same time. Important factors leading to diabetes are age-related insulin secretion deficiency, increasing insulin resistance due to changes in body composition, and sarcopenia. 2. Memory loss, Alzheimer's disease. Alzheimer's disease is a common disease in the elderly that causes dementia, and the disease becomes more severe as the patient gets older. In the early stages, memory loss occurs at a mild level. In the late stages, the patient may even lose the ability to communicate and respond to the environment. The rate at which Alzheimer's disease progresses varies greatly. On average, people with Alzheimer's live 3 to 11 years after diagnosis. But some people can live 20 years or more. 3. Hearing loss. Hearing loss is a gradual loss of hearing in both ears. It is one of the common diseases in the elderly related to aging. Surveys show that 1/3 of the elderly over 65 years old have problems related to hearing loss. This decline does not occur suddenly but changes gradually, so some people do not even realize their health problems. 4. The common cause of this common disease in the elderly is due to changes in the inner ear that occur with aging. In addition, genetic problems and habits when young, frequently wearing headphones, listening to loud sounds, also increase the risk of hearing loss in old age. 4. Cataracts. Among the common diseases in the elderly, cataract is also a common disease. Patients may have partial or complete opacity of the lens. This is an irreversible disease that becomes increasingly serious, leading to complete loss of vision. About 20% of people aged 65 and over have cataracts. About half of people aged 75 and over have cataracts. 5. Osteoporosis. Older people are also at risk of bone and joint problems due to decreased bone density and loss of calcium and essential minerals, making bones thinner and weaker. Older people are more susceptible to osteoporosis. To strengthen bone and joint health and reduce the risk of osteoporosis, the elderly need to exercise at the right intensity and consume foods rich in calcium and vitamin D. 6. Arthritis. A chronic condition that affects many older adults is arthritis, which causes joint pain, stiffness, and swelling in the joints. Arthritis is one of the body's natural responses to illness or injury, and is common, especially as we age. Although there is currently no cure for osteoarthritis, some treatments can help ease symptoms. Exercise is one way to help relieve symptoms of this common disease in older adults. Exercise helps lubricate the joints and strengthen the muscles around the joints. 7. Cardiovascular disease. One of the common diseases in the elderly that is dangerous and life-threatening is cardiovascular diseases such as heart attack, stroke, chronic ischemic heart disease. Plaque buildup can increase the stiffness of the arteries, one of the common changes that the elderly encounter. Although it is impossible to control age-related changes, the elderly can still apply a scientific lifestyle to reduce the risk of cardiovascular diseases, such as limiting the intake of greasy or fatty foods, exercising every day. 8. Cancer. Cancer can develop at any age, but the incidence of cancer increases significantly in the later stages of life. According to WHO Globocan 2022, by 2022, about 53% of people with cancer will be 65 years or older. This shows that there is a close relationship between cancer and aging. Age, in particular, adds to the complexity of living with cancer. Many cancers in older adults are diagnosed at a late stage, because early cancer symptoms can be mistaken for mild age-related conditions. As a result, cancer treatment is often started late, increasing complexity, increasing the risk of serious side effects, and reducing the chance of successful treatment. 9. Pneumonia. When entering middle age and old age, in addition to problems related to nerves, cardiovascular or bones and joints, you may have to face many respiratory diseases. Among them, pneumonia is one of the common diseases in the elderly. What are the signs of pneumonia in the elderly? That is coughing with phlegm and fever. In addition, when having pneumonia, the elderly may also have diarrhea or confusion if not treated promptly, causing the disease to progress severely. 10. Chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, COPD, is a common disease in older people who regularly smoke cigarettes and tobacco. The main symptoms of COPD include shortness of breath, especially during activity, persistent cough with phlegm, persistent wheezing. If left untreated, symptoms often become increasingly severe. During flare-ups, the disease can be life-threatening. 11. Chronic bronchitis. Bronchitis can be acute or chronic. Acute bronchitis in older adults usually clears up in about 10 days. Chronic bronchitis in older adults is more serious because older adults may have weakened immune systems or underlying medical conditions, underlying health problems, and aging lungs. Symptoms of bronchitis in older adults often include persistent cough, coughing up yellow or green phlegm or coughing up blood, feeling short of breath or having rapid, shallow breathing, wheeze, fever. 12. High blood pressure. High blood pressure is a common problem among older adults. The body's network of blood vessels, vascular system, changes with age. Arteries become stiffer, causing blood pressure to rise. This can be true even in people with heart-healthy habits. 13. Depression. In 10 older people, more than one person is depressed. The elderly are at high risk of depression due to many factors. In particular, having other diseases can cause depression directly and indirectly. Specifically, poor health can change the way the body functions, causing depression. Medical conditions also make it difficult for the elderly to live, easily causing frustration and depression. When getting older, not being able to be close to children and grandchildren, not being able to meet friends, lack of social contact, feeling useless, and being a bother to children and grandchildren, make the elderly more susceptible to depression. 14. High blood fat. Hyperlipidemia, high cholesterol, is a common problem among middle-aged and elderly people. If left untreated, high cholesterol can lead to hardening of the arteries and plaque buildup that can block blood vessels, leading to stroke. 15. Chronic kidney disease. What diseases do the elderly often suffer from? Chronic kidney disease is also a common disease in the elderly. People with chronic kidney disease are 2 to 3 times more likely to have a heart attack, and cardiovascular disease remains the leading cause of death for people on dialysis and kidney transplant recipients. 16. Flu. Older adults are at higher risk for severe flu and flu-related complications. Flu increases the risk of heart attack by 3 to 5 times and stroke by 2 to 3 times in the first 2 weeks of illness in people over 65. 17. Stroke. As you age, your risk of stroke increases because your blood vessels become thinner and weaker, increasing the risk of blood vessel rupture leading to cerebral hemorrhage. Plaque buildup in the blood vessels causing atherosclerosis is also a factor that increases the risk of stroke in the elderly due to blockage of blood vessels in the brain. Chronic diseases such as diabetes, high blood pressure, and dyslipidemia that are not well controlled are risk factors for stroke in the elderly. Lifestyle factors from a young age such as lack of exercise, drinking a lot of alcohol, eating fatty foods, being stressed, not getting enough sleep, etc. all increase the risk of stroke in old age. Elderly people can have recurrent strokes if they do not have regular health screenings and do not treat diseases that increase the risk of stroke. Strokes can leave serious complications, causing the elderly to have speech disorders, loss of mobility, vegetative state, or even death. Strokes also increase the financial and psychological burden on patients, their families and society. 18. Urinary tract infection. Urinary tract infection (UTI) is a common infection in the elderly, mainly due to age-related risk factors such as malnutrition, poorly controlled diabetes, poor bladder control leading to urinary retention or incontinence, constipation, long-term hospitalization, vaginal atrophy, prostate enlargement. Symptoms in the elderly with urinary tract infections include burning when urinating, frequent urination or urgent need to urinate, feeling of incomplete bladder emptying, lower abdominal or pelvic pain, fever, chills, fatigue, etc. 19. Digestive disorders. When it comes to common diseases in the elderly, digestive disorders cannot be ignored. Among them, gastric acid reflux, constipation, irritable bowel syndrome, gastrointestinal bleeding, etc. are common problems. Clinically important changes in gastrointestinal function with aging include decreased taste threshold and decreased hydrochloric acid due to atrophic gastritis. These are factors that increase the risk of digestive disorders in the elderly. 20. Shingles. For older adults, shingles pose particularly dangerous problems, increasing the risk of post-herpetic neuralgia and neurological complications of shingles. Typical symptoms in people with shingles include a burning or tingling sensation on the skin in a part of the body, rash, itchy skin, blisters, fever, nausea, etc. 21. Parkinson's disease. When it comes to common diseases in the elderly, Parkinson's disease cannot be ignored. In the United States, Parkinson's disease affects about 2 million people. Most of the patients are 60 years old or older. What is the average life expectancy of an elderly person with Parkinson's disease? On average, a person with Parkinson's disease can live to be over 80 years old. However, the disease causes inconveniences in life, affects the brain and motor function, and the psychology of the patient, making the later life of the elderly no longer comfortable. 22. Asthma. Some older people with asthma have had it since childhood. Others develop asthma as adults. The signs and symptoms of asthma in older adults are similar to those of asthma in other age groups. Signs of asthma in older adults include shortness of breath, cough, chest tightness, chest pain, wheezing, etc. This disease can also easily wake the patient up at night and cause insomnia and difficulty sleeping. 23. Obesity. Obesity rates among older people are increasing and are now a major global threat in both developed and developing countries. Older people are less active and eat more nutritious foods with higher fat content, so the risk of obesity also increases. Obesity is a risk factor for cardiovascular and neurological diseases and stroke, which can lead to death. 24. Dermatological diseases. Older adults are also at risk for skin health problems. As we age, skin cells become more susceptible to damage, tearing, and infection, leading to skin sores. Cells also heal more slowly. Older adults may be more susceptible to infections and pressure ulcers. See more. How dangerous is it for the elderly to have multiple underlying diseases at the same time? Risk factors that make the elderly susceptible to disease. In addition to the aging factor that weakens and makes body cells vulnerable and the immune system decline, middle-aged and elderly people are at higher risk of diseases due to lack of exercise. Elderly people are less active, often lie down or sit in one place. This is a factor that can easily cause obesity, high blood fat and lead to other diseases. Psychological factors. Feelings of dependence on children, uselessness, loneliness, etc. make the elderly easily sad and gloomy. Unstable mental health also affects the physical health of the elderly. Inappropriate lifestyle. Elderly people often have a more relaxed mindset about their lifestyle and activities, and do not maintain a regular eating or resting schedule. This is also a risk factor for common diseases in the elderly.
Thank you, gentlemen and ladies, for taking the time to watch today's video. Maintaining health in older age is an important journey that requires special care and attention. I hope the information and advice I shared will provide you with useful knowledge to maintain your health, live joyfully, and enjoy the golden years of your life. Once again, I sincerely thank you for your attention. Wishing you all good health and happiness. Please subscribe to the channel to motivate me to create more informative videos on health care. See you in the next videos.